Sonya, what does this latest funding mean in the development of diagnostic testing for CFS patients?
Well, it's wonderful news for patients because it will accelerate the screening and diagnostic testing for chronic fatigue syndrome patients and giving them an answer earlier rather than later, which allows them to have legitimacy of the illness at an earlier stage of their illness presentation.
Are there any treatments currently available for chronic fatigue syndrome?
At the present time, there's not one universal treatment available to improve or cure chronic fatigue syndrome. So the important part of this grant is actually assigning funding for us to investigate particular drugs of interest and test them in the laboratory, and then from that work out which drugs we're actually going to trial in a clinical trial with patients.
Don, how does this testing assist in obtaining a case definition of chronic fatigue syndrome, and then explain the patient benefits?
Well, currently the case definition is largely based around symptom presentation. So what's critically important, and to get a gold standard for diagnosis, is to have a laboratory developed test which can be considered in those clinically relevant conditions to make the diagnosis firm. The reason why this is so important is the patients need a diagnosis much earlier in their clinical condition, and this test will enable a more complete understanding of the illness and a firm diagnosis much earlier than would have otherwise been the case.